For the first time in 14 days, daily cases decreased in India due to the lower testing over the weekend. And amid a battle against surging coronavirus infections, India began its booster program for frontline workers and those aged 60 and above. Now, India reported over 168,000 cases. Alongside, the country also reported nearly 70,000 recoveries in the past 24 hours. As of now, deaths in proportions to the infection numbers continue to remain very low. Hospitalizations, while still relatively low, are also beginning to rise in major cities, including the national capital of Delhi. And in view of the rising COVID-19 cases, the Delhi government has ordered the closure of all private offices and restaurants in the city. Apart from this, all private offices have been ordered to work remotely, except those which are exempted. Our principal diplomatic correspondent, Siddhan Sibal, gets us this report from the heart of New Delhi. Take a look.
These empty chairs are a symbol of the impact caused by the COVID crisis. Because of the COVID pandemic, it is the businesses, especially the small businesses, which have been impacted, whether it's restaurant owners or salon owners. Now, of course, these small businesses have been asking the government to reconsider the way forward when it comes to the restrictions that have been put in place. Because of the restrictions that have been put in place for last 2 years, which of course depends on the wave of the COVID crisis, these businesses have been majorly impacted, and that has led to job losses.
काफ़ी इफेक्ट पड़ा है हमारे काम पे. ऑलमोस्ट लगभग 15 दिन से काफ़ी इफेक्ट पड़ा काम पे. सैनिटाइजर वगैरह काफ़ी अच्छे से करते हैं, मगर क्लाइंट जो भी क्लाइंट का फ़ोन आता है हमसे बोलता है अभी नहीं, हम नहीं आ पाएंगे अभी. इसलिए काम पे काफ़ी असर पड़ा है और काफ़ी लॉस बिजनेस जा रहा है. तो सरकार इसमें क्या करेगी? सरकार तो कोशिश कर ही रही है दम पे दम, मगर इसमें सरकार का कोई वो नहीं है घोष. इसलिए कोविड के केसेस पे केसेस बढ़ते जा रहे हैं, तो इसलिए काम पे ज़्यादा असर पड़ा है.
Takeaway is the only answer, and somehow the takeaway is not everybody prefers takeaway, because food is not just a meal, it's a whole experience. You don't just want to eat, you want to go out, you want to sit in the environment, order in the food. So I guess we'll just have to sort of, unless and until you have a craving, there's nothing you can't do.
Because of the COVID crisis, it is the businesses, especially the small businesses, which have been impacted. Restaurant owners, salon owners have been impacted because of the restrictions that have been put in place. We know in past 2 years there have been several restrictions, and even as country sees a resurgence of the COVID pandemic, restrictions have been put in place by various local governments, including the Delhi government here in the national capital. Now, because of these restrictions, many of the owners of salons and restaurants have told WION that there have been a lot of impact, not only on the owners but also on number of people working at these places, and it is the job losses that they fear, which has been happening over last 2 years and has now become a permanent feature because of these restrictions that are being put in place to deal with the COVID crisis. With video journalist Neeraj Patel, Siddhan Sibal for WION in New Delhi.
Now, across the country, healthcare workers and senior citizens continue to queue up for a second day outside vaccination centres across the country to receive the third dose of the coronavirus vaccine. The government said that the country is witnessing a 5 to 10% hospitalization rate in the third wave. The government also said that considering the dynamic and evolving situation, the need of hospital care may change rapidly. During the second wave, hospitalization rate in India was in the range of 20 to 30%. The Indian Council of Medical Research has also revised its testing guidelines. As per the latest announcement, contacts of COVID-19 patients do not need to be tested unless identified as high risk based on age or comorbidities. Now, the advisory further said that individuals undertaking interstate domestic travel also don't need to get tested. So far, experts believe India is better prepared than it was last year when Delta variant overwhelmed hospitals. In March of last year, when cases spiked, not even 1% of India's population was fully vaccinated. Now, about 47% of its population is fully vaccinated. Although the Omicron variant seems to cause less severe illness than the Delta variant, the health system in India, that is still recovering from the previous Delta wave, could still become strained.
WION, now available in your country. Download the app now. Get all the news on the move.